While families are navigating their grief, providers are absorbing a lot of conflict. Nurses may feel like they're caught in the crossfire. A lot of times, physicians may feel like they are experiencing moral distress when asked to continue treatments that go against the patient's wishes. And the emotional toll can just contribute to burnout and dissatisfaction and things like that. And many nurses will say this. They feel like when they're caring for a patient, they're not just caring for a patient, they're caring for the patient's entire family. And I've taken care of, like I said, many of these patients and many of these families over an extended period of time. And it's one of the biggest challenges I face because of the setting my emotions aside after dealing with that patient. Or once I go home, I go home to children, I go home to my significant other. They don't want to moping around mom or wife because of what I went through at work, because that could be my job every day. In the end, when I was a hospice nurse, I knew how my patient contact was going to eventually end in death. And so that is, just something to keep in mind. And then it's very difficult to walk around and act like nothing happened and be polite and respectful and empathetic and compassionate every time we then interact with you. We always seem to be that way with the patient, but when you are the patient and you want us to involve your family in your care, but your family is being extremely disrespectful and rude, that makes that very challenging to do. So, there's this mnemonic that I learned in hospice. Because sometimes things are hurried in hospice because patients get put on hospice at the last minute. And so there's sometimes a lot more conflict if a lot of people didn't know what was going on with the patient prior to the hospice diagnosis. But the mnemonic is calm. And this is how to deal with difficult family dynamics. 1, the C in calm. Communicate clearly and consistently. This is one of those situations where you want to over communicate, over check on people, and be extremely clear. You need to make sure that you're paying attention to your own body language. Every way that we communicate, you need to be on point with it. And make sure that they're hearing you. And make sure that they're understanding you, which you can usually figure out by body language. Acknowledge everyone's emotions, because truly, even though there is a right and a wrong way to deal with people, especially healthcare professionals, acknowledging everyone's emotions is just a good way to make sure everybody knows that they're being heard and seen, and that one person's anger is no more important than the next person's tears or sadness. Then you want to leverage the team, the L in calm, leverage your team. And when I talk about team, I'm talking about the healthcare team. Get the chaplains involved, get the social worker involved, get the any kind of spiritual support there is, get the other nurses involved, get CNAs involved, get therapists involved, keep the patient busy. There's things, utilize the team and there's the tools you have available to you so that one healthcare team member isn't having to absorb all of that for the entire team. And then mediate conflicts early. You will know when something is brewing. And it's best to just confront it and say, is there a question? Can I explain something a different way? Talk with the patient privately. You can always talk with the patient privately, especially if they are completely with it, as long as they are agreeable to that. And just say, up until this point, your wishes have been this. So I just want to make sure that we're all on the same page in regards to the course of your treatment based off of your wishes. And so just get in front of it, mediate that stuff as soon as you see it coming so that it doesn't fester and become a bigger thing than it needs to be. So calm, communicate, acknowledge, leverage, mediate.